Sleep health and prevention of sudden death risk in older adults over 70 years old. Senior health. Did you know a 71-year-old man went to bed perfectly fine and never woke up? No signs, no warnings, just silence. His family was devastated. What if I told you that something as simple as when you eat dinner could silently be putting your life at risk? After 70, our bodies don't work the same way, especially at night. And yet, most people continue one bedtime habit that increases their chance of heart attacks and strokes while they sleep. If you're over 70 or care about someone who is, you need to hear this, because it might just save a life. If you found this video helpful, don't forget to hit the subscribe button and turn on the bell for more life-saving tips and wellness advice. Your support means the world to us, and it helps us keep creating valuable content to protect and empower our community, especially those over 60. Let's stay strong and healthy together. Number 1. Dinner too late and too heavy. Eating heavy meals too late at night is one of the most dangerous bedtime habits after the age of 70, yet it's something many seniors continue doing without realizing the risks. At this age, your body no longer processes food like it did decades ago. Metabolism slows down, digestion becomes less efficient, and your organs need more time to break down food properly. When you eat a large, heavy meal just before bed, especially greasy, fatty, or high-carb foods, your stomach stays active for hours, producing acid and working overtime. This disrupts the natural process of deep sleep, keeping your heart rate elevated when it should be slowing down for rest. The result? Increased risk of nighttime heart attacks, strokes, and serious sleep disorders. If you've ever woken up at night with heartburn, bloating, or racing heartbeats, chances are your late-night eating is to blame. When you lie down soon after a heavy meal, stomach acid can rise into your esophagus, causing acid reflux, coughing, and even choking sensations that interrupt your sleep. Over time, this can weaken your throat muscles and increase the risk of aspiration pneumonia, a lung infection that can be fatal for seniors. What's even more dangerous is that these symptoms often go unnoticed or are ignored until it's too late. In people with diabetes or prediabetes, eating late at night can also cause blood sugar spikes that are harder to regulate while sleeping, raising the chances of glucose imbalances and further cardiovascular stress. To protect your health, stop eating heavy meals within 3 to 4 hours before going to bed. Give your body the time it needs to digest before lying down. If you feel hungry close to bedtime, choose something light and easy to digest, like a few almonds, a slice of apple, or a cup of warm herbal tea. These options can calm your digestive system and even help you sleep better, rather than burdening your body. Avoid foods high in sugar, fat, or salt late at night. They may satisfy a craving temporarily, but the long-term effects are damaging, especially for older adults whose bodies are already more vulnerable to stress and inflammation. Remember, at this stage of life, even small habits can have serious consequences. You may feel fine after a late meal today, but the silent effects on your heart and brain could build up over time. If you truly want to improve your sleep quality, lower your risk of stroke and heart issues, and wake up feeling refreshed, changing your eating schedule is one of the easiest and most effective things you can do. You don't need to go on a strict diet. You just need to be more mindful about when you eat. Make this change tonight. It might seem small, but it could save your life. If you found this video helpful, don't forget to hit the subscribe button and turn on the bell for more life-saving tips and wellness advice. Your support means the world to us, and it helps us keep creating valuable content to protect and empower our community, especially those over 60. Let's stay strong and healthy together. Number 2, drink plenty of water before bed. Many seniors believe that staying hydrated is always good, but drinking too much liquid before bedtime can quietly damage your health after 70. If you often wake up 2 or 3 times during the night to use the bathroom, that's not just a minor inconvenience. It's a serious warning sign. As you age, your bladder muscles weaken, your kidneys continue filtering fluids overnight, and your body becomes more sensitive to small amounts of liquid. This means even 1 glass of water, juice, or tea before bed can send you running to the bathroom at 1 a.m., 3 a.m., and again at 5 a.m. ruining your sleep and putting you at risk of something far worse: nighttime falls. Getting out of bed in the dark, half asleep with low blood pressure, can trigger postural hypotension, a sudden drop in blood pressure when you stand up. That leads to dizziness, lightheadedness, and in many cases, falling. For seniors, a fall in the bathroom can be deadly. Hip fractures, head injuries, or spinal trauma can instantly change the rest of your life, and it all starts with too much liquid too late in the day. Even if you don't fall, every time you wake up and turn on the light, your brain gets tricked into thinking it's morning. This interrupts melatonin production, the hormone responsible for deep sleep, and weakens your body's ability to repair itself. Interrupted sleep has also been linked to higher blood pressure, a weakened immune system, and faster cognitive decline. In fact, studies have shown that seniors who wake up multiple times a night are at greater risk for dementia and memory problems. So what's the solution? Stop drinking large amounts of fluid 2 to 3 hours before bed. Focus on hydrating earlier in the day. Drink water in the morning, with meals, and throughout the afternoon. By the time evening comes, taper off. If you feel thirsty after dinner, take small sips instead of a full glass. And avoid diuretics like caffeine and alcohol in the late afternoon and evening. They force your kidneys to produce more urine and make nighttime waking worse. Also be aware of hidden sources of fluid in your diet. Soups, juicy fruits, and even certain medications can all contribute to overnight fluid overload. By planning your hydration wisely, you can sleep through the night, protect your brain, and reduce the chance of accidents. It's not about drinking less water overall, it's about drinking smart. Sleep is just as important as nutrition or exercise for your long-term health. And that means giving your body the chance to rest uninterrupted. Make one simple shift today. Drink more during the day, less at night. Your bladder, your heart, your brain, and your future will thank you. Number 3, the bedroom is too warm and too closed. Sleeping in a warm room may feel cozy at first, but for people over 70, it can silently harm your health in serious ways. As we age, our bodies lose the ability to regulate temperature efficiently. The ability to sweat declines, circulation slows down, and the body takes longer to cool itself. If your bedroom is too warm, your heart must work harder during the night to help your body release excess heat. This unnecessary strain increases the risk of heart attacks, high blood pressure, and even strokes, especially in seniors with pre-existing heart conditions. You may think you sleep better when wrapped in heavy blankets or with a thermostat set to a comfortable 75 degrees Fahrenheit, 24 degrees Celsius. But if you frequently wake up feeling sweaty, tired, or out of breath, your sleeping environment is likely the problem. Overheating during sleep prevents your body from reaching deep sleep stages, those vital periods when your immune system repairs cells. Your brain stores memories and your body restores energy. Without those stages, you wake up groggy, unrefreshed, and more vulnerable to illness and mental decline. Another hidden danger of a warm bedroom is dehydration. Even mild dehydration at night can cause your blood to thicken, increasing the risk of clot formation, which can trigger a heart attack or stroke. And because you don't feel thirsty while asleep, you may not even realize your body is losing water through sweat. This is especially dangerous for older adults, whose bodies already retain less water than in younger years. To fix this, aim to keep your bedroom temperature between 60 and 67 degrees Fahrenheit, 15 to 19 degrees Celsius. It may sound too cold at first, but your body actually sleeps better in a cooler environment. Choose breathable cotton bedding instead of heavy synthetic blankets that trap heat. If you need to layer, use several light blankets so you can adjust easily through the night. Avoid fleece or thick comforters unless the room is truly cold. Also, wear lightweight, moisture-wicking sleepwear to allow your skin to breathe. Simple tricks like opening a window for fresh air or using a quiet fan to circulate air can also help regulate room temperature and improve overall air quality. Another key to better sleep. Cleaner, cooler air reduces your risk of respiratory issues like nighttime coughing or shortness of breath, which can interrupt sleep and put stress on your heart. Making this one adjustment, cooling your sleep environment, can lead to deeper rest, better cardiovascular function, and even improved brain performance. You don't need to suffer through poor sleep or wake up drenched in sweat. Try lowering the temperature tonight and feel the difference when you wake up refreshed, energized, and protected. Sometimes a cooler room isn't just more comfortable, it's a life-saving habit. Number 4. Sleeping in the wrong position. Sleeping in the wrong position may seem harmless, but after age 70, it can quietly put your life at risk. Most people don't think twice about how they sleep. As long as it feels comfortable, they assume it's fine. But for older adults, certain positions can disrupt breathing, strain the heart, and lead to dangerous conditions like sleep apnea, poor circulation, and even heart failure. One of the riskiest positions for seniors is sleeping flat on the back. While it may feel restful, this posture allows gravity to pull the tongue and soft tissues back into the throat, partially blocking the airway. This can cause obstructive sleep apnea, a condition where breathing repeatedly stops and starts during the night without you even realizing it. Undiagnosed sleep apnea doesn't just affect your rest. It puts constant stress on the heart, raises blood pressure, lowers oxygen levels, and increases your risk of stroke and sudden cardiac arrest. You may notice symptoms like waking up with headaches, feeling tired even after a full night's sleep, or having trouble concentrating during the day. But many seniors dismiss these signs as just normal aging, when in fact it's their sleeping position slowly wearing down their health every night. Sleeping on your right side may feel like a safer alternative, but studies show it can put added pressure on the heart and make blood circulation less efficient, especially for those with heart conditions. Over time, this can lead to fluid buildup in the lungs or legs, contributing to congestive heart failure, shortness of breath, and swelling. In contrast, the safest and most beneficial sleeping position for people over 70 is lying on the left side. Sleeping on the left side supports better circulation, allows the heart to pump more freely, and helps your digestive system function more efficiently. It also reduces the risk of acid reflux, as gravity helps keep stomach acid from creeping up into the throat, making it ideal for seniors who suffer from heartburn at night. If you're not used to sleeping this way, try using a full-length body pillow to keep your body from rolling onto your back. You can also elevate your head slightly with a supportive pillow to help keep your airway open and reduce snoring or breathing interruptions. For those with joint pain or lower back issues, placing a pillow between the knees while sleeping on your side can also improve spinal alignment and ease pressure on the hips. It's a small adjustment that can drastically improve sleep quality and lower health risks without medication or surgery. Changing your sleep position may not feel natural at first, but with a little effort and consistency, it can become a life-saving habit. Tonight, take a moment to check how you sleep, because something as simple as how you position your body could be the difference between peaceful rest and hidden danger. If you found this video helpful, don't forget to hit the subscribe button and turn on the bell for more life-saving tips and wellness advice. Your support means the world to us, and it helps us keep creating valuable content to protect and empower our community, especially those over 60. Let's stay strong and healthy together.